Welcome to the discharge meeting. Medication usage after gastric surgeries. Pantactive stomach liner. Take on an empty stomach 1 time in a day for 28 days. Oxef, Cipro, Cipronatine antibiotics. Take on a full stomach 2 times in a day for 7 days. Voltaren SR, Dexofan, Declaron SR, painkiller. Take on a full stomach 2 times in a day. Take only when needed. Enox 4000, Axiparine 4000, blood thinner. You can apply the injection 4 fingers above your elbow and inject in the upper area 1 time in a day for 7 days. If your BMI is higher than 50, Enox Axiparine will be advised as 6000. Enox 6000, Oxapar 6000, blood thinner. You can apply the injection 4 fingers above your elbow and inject into the upper area. These injections of 6000 will be advised if your BMI is higher than 50. Prescriptions that we give the patients who have low hemoglobin and vitamin D levels should be taken before discharge. Low iron levels make you feel tired and dizzy. Low vitamin D affects the functioning of the metabolism negatively. Post-obesity surgery controls. We require the following tests of you over the course of the next 12 months. The first month, blood test. The third month, blood test. The sixth month, blood test and abdominal ultrasound. The ninth month, blood test. 12-month, blood test and abdominal ultrasound. General recommendations after gastric surgeries. To prevent the risk of embolism, accumulation of the blood in the vein and causing clotting in the vein, wear anti-embolic socks given to you by our nurses after the surgery to stay above the knee for 10 days while you are sleeping. If you need any extra socks, please let your coordinator or the floor nurse know. They'll happy to provide you extra socks. Do your TriFlow breathing exercise for at least 5 minutes every hour after the surgery. This will help your lung capacity to return to normal. Continue to do your exercise after discharge from the hospital for at least 10 more days. The pain experienced after the surgery is usually gas pain. 4 hours after the surgery, it is important to start walking slowly by the hour to eliminate this complaint. We want you to go for walks during your entire stay in the hospital. Also, after your discharge, it is important to go for routine walks every day from that point on. Any bandages or strips that remain must be removed upon arrival back home. Keep any bandages or strips on during your journey flight home, but when you arrive home, make sure you remove them. Any strips or bandages that are left on longer cause a risk of infection. During your flight, try to move your legs while you are sitting. It is important that you're wearing your anti-embolism socks during your flight. Also, while waiting for your flight, it is important that you walk around. If you do not have to drive a car, we do not recommend you to drive. But if you have to drive, take a break every 30 minutes while you're driving. This is especially important for patients who have to drive home back from the airport. Make sure you give a break every 30 minutes and go for a walk around the car. We do not advise you to drive a car for the next 10 days. After surgery, hair loss can occur in any period between the 3rd and 9th months. Hair loss is not permanent. Your hair will return to its normal state when the weight loss process is completed. In consultation with your doctor, you can use a multivitamin and collagen supplement containing iron, zinc, and biotin. This will keep your hair loss at a minimum. Smoking is not recommended after surgery. Smoking can seriously affect your post-op healing process. It is not recommended to become pregnant for 1.5 years after the surgery. Nutrition program. Golden rule: stop consuming liquids 30 minutes before your meals. It is important to keep 30 minutes between your liquids and your solids. Consume 6 to 8 glasses of liquid per day. Take a sip of your drinks and drink slowly. Do not use a straw, as you take in too much air by using a straw. Plant-based protein supplements for vegetarians and vegans. Below you can see a few examples of supplements that are suitable to be consumed by vegetarians and vegans. Eat your meal slowly and chew properly. Make sure that the time spent on each meal is at least 30 minutes. When you feel satiety during a meal, stop eating. Symptoms of oversaturation are bloating, nausea, pain burning sensation from your stomach to your chest. Strive for a healthy and balanced diet. Do not include foods and drinks with a high calorie content in your diet. The stages of nutrition in your diet may vary depending on the person, so act according to your tolerance status. Important. Consumption of nutrients may vary from person to person. According to the tolerance status, you should continue the diet under the supervision of your doctor and dietitian. Stage 1. Clear liquids. Days 1 to 3 in the hospital. A clear liquid diet is a diet that is prescribed in the first 3 days after surgery. In this diet, water, meat, and chicken broth, protein supplements, non-carbonated, decaffeinated, and sugar-free drinks are recommended. Carbonated, caffeinated, sugary drinks, and solid foods are among the prohibitions. Consume fluids in small amounts and throughout the day. Consume at least 6 to 8 glasses, approximately 1.5 liters, of water. Drink your drinks by sipping them slowly. Never use a straw. The liquids you consume should be warm or room temperature. Stop eating when you feel full. If the feeling of satiety causes discomfort, you should immediately take a walk and relax your stomach. Make a note of the amount of liquids you consume. Water, tea, protein supplements, grainless and unsweetened compoted juice without sugar, meat and chicken broths, freshly squeezed and diluted juice, except citrus juices, orange juices, 100% diluted juice. Stage 2. Full liquid, first to second week. Put in consideration your daily consumption of 1,800 milliliters of liquid. Consume 60 to 80 grams of protein per day. The consumed liquid should be warm or at room temperature. The recommended nutrients at this stage are 1. Water, light tea, linden, sage tea, decaffeinated coffee. 2. Lean and grain-free soup, lean meat and chicken broth. 3. Fat-free cheese, soya almond milk, etc., skimmed and lactose-free milk. 4. Probiotic milk and yogurt, natural kefir, or Actimel. 5. Pudding made from unsweetened and skimmed milk. 6. Freshly squeezed and diluted juice, grain-free and sugar-free compoted juice. 7. Fat-free and lactose-free yogurt, buttermilk. 8. Protein supplements in amounts recommended by your doctor and dietitian. Prohibited foods. 1. Do not consume caffeine until the fourth stage. It can irritate your stomach. 2. Dark tea. 3. Juice of citrus fruits, such as oranges or lemon. 4. Carbonated drinks and alcoholic beverages. 5. Packaged powdered soups. 6. High sugar content and flavored drinks such as chocolate milk or milkshakes. 7. Pepper and tomato paste. Menu samples. For some menu samples, you can refer to the booklet given to you. Stage 3. Pureed food. Third to fourth week. All the rules of the liquid diet stage are also included in this stage. At this stage, all the nutrients are mashed or blended. Stir and cook your food until completely smooth and if necessary strain the pieces. Start each meal with 1 to 2 spoons of food and gradually increase it. Take 30 minutes for each meal. Eat your meals by chewing very well. Eating when a feeling of satiety occurs or nausea, stop eating. In the initial stages, this condition may occur after every 2 spoons. If you have difficulty consuming pureed foods, return to your liquid stage for a couple days. Start meals with protein source foods, then vegetables, fruits, and finally complex carbohydrate source, whole grain, pasta bread, oatmeal, etc. can be consumed. Be sure to consume 60 to 80 grams of proteins a day. Take the nutrients on a plate to ensure portion control and do not add extra portions. Also use small plates and glasses. This is recommended to control your portions. all the nutrients in the liquid diet phase: low fat cottage cheese, low fat milk, yogurt, ayran, yogurt mixed with water, kefir, low fat meatballs, poultry, and fish puree or minced meat. Canned fish, such as tuna or salmon, can be included in the diet, but if the amount of fat is excessive, it should be filtered and chewed well. Egg, well cooked vegetables, which are not causing flatulence and bloating, such as zucchini, spinach, fresh beans, eggplant, or carrots. Mashed potatoes, mashed fruits, oatmeal, whole wheat flour. Protein supplementation should be continued under the supervision of a doctor and dietitian. Prohibited foods: fatty and fried red meat, poultry and fish, vegetables fried in oil, raw and hard, fruits with peel, core, and heart, pasta, rice, bread, and bakery products, butter, butter of oilseeds such as hazelnuts, peanuts, almonds, whole milk and dairy products, fast foods, bouillon tablets, pepper and tomato paste, vegetables and legumes that can cause gas and bloating, such as broccoli, beans, lentil, and cauliflower. Do not consume caffeine until the fourth stage. It can irritate your stomach. Dark black tea, juice of citrus fruits and berries, such as oranges and grapefruits, mineral water, carbonated and alcoholic beverages, foods with a high sugar content and flavors, such as chocolate milk and milkshakes. You can prepare these drinks at home in a healthy way. Here are a few sample menus. Stage 4: Soft strict diet. Transition to a regular diet. Fourth week and after. All the rules of the puree stage diet are also included in this stage. In this stage, the nutrients become more fibrous and require proper chewing. At the first stage, prepare the food by chopping or crushing it well. Gradually switch to normal nutrition. Eat your meals slowly and chew your food properly. Consume at least 6 to 8 glasses of water daily. Continue to eat decently as a 3 meal and 2 to 3 snacks. Take about 30 minutes for each meal. If you have difficulty consuming soft solid foods, consume liquid or mashed food for a couple more days. Start your meals with protein source foods. Then you can consume vegetables, fruits, and finally carbohydrates. Consume between 60 to 80 grams of protein daily. Stay away from these foods for a healthy life. Foods containing sugars, honey, jam, candy, biscuits, cake, cookies, and chocolate. Alcoholic beverages, soft drinks, carbonated fizzy drinks such as cola, soda, ready-made juices. Fried foods, margarine, all fatty foods such as cream and mayonnaise. Processed meat products such as sausage and bacon, steak, foods that are too salty such as pickles, prepared foods of unknown content. Alcohol can be consumed after 6 months, but only as red wine. 1 or 2 glasses per month are allowed. How much energy do you need daily? Protein, carbohydrate, and fat. The first month after the surgery, focus on your protein intake. It should be around 60 to 80 grams of protein daily. After 1 month, the daily protein need is your ideal weight times 1.5 to 2 grams of protein. For example, if your ideal weight is 70 kgs, it's 70 times 1.5 to 2 is 105 to 140 grams as daily protein intake. 50% of your plate must be protein, 35% must be vegetables, and the remaining 15% should be carbohydrates. You should consume around 800 to 1200 calories daily. How to prepare your protein shake. 1 sachet of protein can be mixed with any kind of milk, dairy, almond, or coconut, or water. It is recommended to prepare with milk to increase the protein intake. 1 sachet of protein plus 200 milliliters of milk or water. Exercise after gastric surgeries. There may be weakness in the first 1 month after surgery. For this reason, no special sports are recommended, but you should also not give up on your daily activities. After surgery, from the week onwards, you should start to take regular walks. From the first month, you can do swimming, Pilates, or work with personal coaches. From the fourth month on, you can start doing fitness. But for the first 3 months, you should definitely avoid exercises that increase intra abdominal pressure. Sexual life. Although the healing process differs from person to person, sexual activities can be started from the second week onwards. Avoid making movements that will increase intra abdominal pressure and force yourself. If you feel pain and soreness, wait a while longer to fully recover. And remember, if you have any questions at all, please do not hesitate to contact us whenever you want. We wish this new life you started bringing you health, luck, lots of joy, and peace. Remember that you have strong support at every stage. We are always with you with all our strength.